Hey everybody, happy Friday. So this week I had my appointment with my MS specialist. I see him usually about every 8 to 9 months. My last appointment with him was November of last year. So, of course, the main topic for this appointment was my pregnancy, asking me how everything was going. And we also discussed, what could possibly happen after delivery and how we will approach that. So just a few things he did mention to me. As we all know, they really say that pregnancy does help a lot with MS. A lot of people will say that your MS is completely almost like in a remission, it's on hold, you feel a lot better, which he said is very true, but he also said that there is still a chance a woman can have an MS attack while they are pregnant. It's not completely ruled out. So he really said, fingers crossed that doesn't happen, but just to be aware that if I start getting symptoms that I am having an attack, to let the clinic know, because it is definitely possible. We did talk about after delivery and kind of what's going to happen at that point. He said it's my choice if I want to go right back on medication or if I want to wait a little bit. Of course, if I go right back on my medication, I cannot breastfeed. And to be honest, I haven't 100% made the decision how long I'm going to breastfeed for. I'm definitely going to try, but also I don't really want to be off medication for a very extended period of time, just in case you do have a relapse or an attack after delivery, which could make your health situation much worse. So it's something over the next, 6 months that I really need to decide how I'm going to approach that. One thing that he did mention that I actually wanted to know is that if I do decide to breastfeed and I do have an attack, can you receive steroids, which is what they use on most patients when you are having an attack to kind of help you recover from it. And he said 100% you can receive the steroids while you are breastfeeding. I guess that doesn't get passed through the breast milk and it's a non-issue. So I was really happy to hear that. One of my concerns with that, though, was I remember when I had my first big attack, I was in the hospital for 9 days, and 5 of those days in the hospital I received IV steroids. And really, with a newborn, nobody wants to be in the hospital for 5 days. So I kind of discussed that with him. I know with steroids, you can take it in pill form. So anyways, it's something that we did address. And if it comes to that, we can address it more at that time, but he said that he would figure it out and work with me on that with the clinic and just make sure that everything goes smoothly. So those are really just like the main things we talked about. He said that after delivery, I'm going to probably have fatigue like I've never experienced before. He said probably for the first few weeks, maybe months, I'm going to be extremely tired. And to make sure I actually have as much help as possible, he said, because more than likely I'm really going to need it. So luckily I do have a really good support system behind me, and I know I will have the help there if I need it. So now going forward, it's just taking care of myself, taking care of my baby, and hoping that everything goes smoothly for the rest of the pregnancy and after. He did say that he would have me scheduled for an MRI in about April because I haven't had one in a year and a half. So they just would like to see probably what's going on, especially after the pregnancy and after delivery. And then I'll see him again in June to give him an update and see how that MRI went. So I just thought I would kind of inform everybody of how that topic went with my MS specialist. And of course, he said if anything changes, I can contact him immediately and they will address anything that's in regards to my MS. So thank you for watching today's video, and I hope you have a great weekend.